Welcome to Health and Wellness. I'm Dr. Jennifer Ashton. New guidelines on breast cancer screening recommended by the U.S. Preventive Task Force have sparked a fair amount of anger and confusion among women and their doctors. As a practicing gynecologist, many of my patients have voiced their concerns over the new guidelines, and here's what they had to say.
Hi, I'm Stacy from Norwood, New Jersey. I don't understand why we were encouraged to have a mammogram every year for the last 10 years, and now all of a sudden it's not required.
Excellent question, Stacy. There's a couple of important things to note. One is that medicine and the field of science is always evolving, it's always changing. So things necessarily that were considered standard practice 10 or 20 years or more in the past really should be reevaluated periodically, and the hopes are that in doing so we will improve upon those things. I think when you're talking about breast cancer screening, however, your question brings up a very important issue, which is that women and their doctors have been really educated to do self-breast exams and get yearly mammograms for quite some time, and that has become standard practice for millions and millions of women. So to hear news like this can be very jarring, and I think the good thing that comes out of it is that it reminds us that we do need to periodically reassess our science and our data and our information and make a very informed and intelligent choice, both as individuals and as the medical community.
I'm Vivian Siegel from Tenafly, New Jersey. I would like to know if the people on the panel who propose these guidelines are willing to take responsibility for the lives that could be lost as a result of their decision.
Really, in order to understand the impact that these new recommendations have, many people are familiar with the numbers that were covered in the media when this story broke. And those numbers, which came out of the Preventive Task Force study, found that in the age group of women who are 40 to 49, 1,900 screening mammograms would have to be done to save one life. Then from 50 to 59, that number drops to 1,300 to save one life, and it goes way down to about 377 when you're talking about women 60 and over. Now, in the media, most people really focused on those numbers of 1,901 and said, well, what if you're that one life? Well, I'm going to give you another way to think about those numbers, which is that in younger women, and because that's really the controversial age group for these recommendations, because we know that mammograms have their limitations in younger women, though in my opinion it's the best imaging test we have right now to screen for breast cancer. If you look at that age group in this country, ages 40 to 49, according to the latest census data, there are 22 million women in that age group. 65% of them get yearly screening mammograms, which is 14 million people. Now, if you have to do 1,900 mammograms to save one life, you're talking about saving not one life in that age group, but closer to 7,500 lives. That's 7,500 women whose lives would be saved by getting a screening mammogram in their 40s. So I think you always have to be careful when you hear numbers thrown out in conjunction with medical or scientific studies, that really there are always multiple different angles to look at them, and you really have to be careful before making any kind of sweeping generalizations or assessments based on one set of numbers.
My name is Marianne Hoogerhide. I'd like to know who is sitting on this task force deciding when women should or should not have their breast examined.
Who's on this task force? A lot of people have been asking that question. The task force is a government-appointed panel of medical and scientific experts who are not federal workers, however. So they don't get paid by the U.S. government, but they're appointed by the U.S. government. And they consist of medical doctors, MDs, PhDs, those with masters in public health, and they come from various specialties within the field of medicine. Notably, however, for these recommendations, that panel did not consist of a board-certified radiologist or a doctor who's really an expert in imaging tests, nor did it consist of a medical oncologist or cancer specialist. So the strength of these individuals is that they are really research scientists in healthcare and medicine, but they probably do not sit across the desk and take care of individual patients anymore. So again, they have their strengths, but this is not the end-all and be-all by any means.
Hi, my name is Wendy Meyer. I'm from Norwood, New Jersey, and I'd like to know who benefits the most from this.
Well, Wendy, when you ask the question who benefits most from these guidelines, I think that really does bring in the issue of cost, or the concept of evidence-based medicine. And that is clearly an important aspect of the way we should practice medicine in this country, and in the overall political hot topic of healthcare reform. And even though the task force says that cost did not enter into their analysis at all, obviously there are many, many women and many doctors who feel a degree of skepticism about that. They do realize that the task force recommendations are considered the quote-unquote gold standard in this country, and the task force does pass along its recommendations to the Department of Health and Human Services, and the insurance companies then in turn do take their cue from the HHS recommendations. So there are long-term insurance and cost implications to this that I think we're just going to have to wait and see how they play out. At this point, however, the insurance industry and Medicare emphatically states they have no plans to change their reimbursement practice or policies for mammograms, but we'll have to wait and see what happens in the future. It's important to remember that any test has its benefits as well as its risks. With that understanding, I am still recommending that my patients continue to perform self-breast exams and get yearly mammograms. Thanks for joining us for another episode of Health and Wellness. I'm Dr. Jennifer Ashton, wishing you good health.